When he heard the home phone ring after 2 cell phone calls, he goes, oh my God, after midnight, this is not good. As a parent, he just woke up. So that woke me up. And then, he said, Mallory's been in an accident. We had no clue at how bad it was.
I first met Mallory when she was in the neurotrauma ICU. I walked into her bedroom and, I assessed her with Dr. Liao, and we then made the decision to enroll her because she was a good candidate. And then we later on approached the family about the study. So, she wasn't in great shape at the time, but that's, I think, most of our patients tend to be in that situation.
They had told us about the children's research. They said, we can't give you any concrete answers, but we can tell you what we have seen. And that was positive enough for us that we didn't feel like we were risking anything with her and that she would have a lot to gain because she was in a very, very precarious situation. Anything that would help her, we were game to do it.
Over 10 years ago, we got involved in exploring the use of autologous, our own, stem cells derived from your bone marrow for the treatment of traumatic brain injury. And back in the 1990s, early 2000s, it was thought that these cells somehow replaced injured or damaged or dead cells after the initial kinetic injury. Fast forward 10, 15 years, and what we've come to learn through a host of preclinical studies, studies that help not only prove the concept that these cell-based therapies are beneficial, but also kind of how they work. We've come to know that those cells change the body's what we call innate immune response, your body's response to an injury that can be initially helpful, but if out of control, is damaging. And so this whole issue of the secondary response to the initial injury, that inflammation, what happens is these cells dial down that inflammatory response and flip the body into a more reparative instead of a more inflammatory state. And we infuse these bone marrow derived cells in this at-risk area that we're trying to preserve, salvage, bring back, and that takes a little bit of time to get them back online and functioning, and then that's what we see clinically in patients getting better through that treatment and a whole host of other treatments. We enrolled Mallory in the clinical trial, and my biggest concern and sleepless nights about her were she had very, very difficult to control intracranial pressure, which means the inflammation, that secondary injury we talked about in terms of brain inflammation and swelling was very, very difficult to control. Despite we kind of threw the kitchen sink at her at every possible intervention that we had. And usually when that happens, it portends a bad outcome.
Lo and behold, she started moving her left arm and left hand, and so at that point, we got really excited, and at that point we had developed a pretty close relationship with the family members, and so I called Mom, and she got really excited, and I think from that day, I think we started seeing little improvements day by day.
I met someone named Dr. Liao. He works in the research project as well. He came visit me at the rehabilitation hospital I was at. And he was so excited that I was talking to him that he pulls out his cell phone and he says, "Can you talk for 40 seconds to someone on the phone?" I said, "Sure." "Who are they? Who am I talking to?" He said, "It's Dr. Cox. He was your research doctor." I said, "Okay, whatever. Hand me the phone." So he handed me his cell phone, and a very friendly guy was on the other end, and he said, "Hi." I said, "Hi, Dr. Cox." And he said, wow, like that's all I remember him saying. He was so happy that I was talking and making sense, and I just said thank you, and I didn't really even know what I was thanking him for, but I knew he was a good doctor, so.
When we get a call like that, when we had the expectation of things not going well, that really energizes our group, energizes me to really move forward on pressing on and not get discouraged by these little irritations. And because I think we're having some potentially big impact down the road.
Certainly in institutions like ours, with the breadth of expertise at UTHealth, have the ability to take care of literally any type of critically ill patient from the minute they are injured to the minute they go to rehab. However, most of the support for those patients with traumatic brain injury is to prevent further injury and to stabilize the individual. They're not actually therapeutic. And we're very excited about these trials for traumatic brain injury, and Mallory would be a great example. Because it offers the opportunity to actually have a therapeutic advance for the existing injury.
I saw the video of what happened to me when I was still in the hospital, and seeing that and then being okay, still being here, is definitely a miracle.